What do I expect month-wise after my transplant? Every patient is anxious to know this, and every time I have a consultation, this is exactly what patients want to know. What do I expect after surgery, or what do I expect in the following months after I get my hair transplant done? I am Dr. Desai. I am a board-certified cosmetic, plastic and hair transplant surgeon with over 20 years of experience. I have given multiple talks globally and nationally regarding hair and hair transplant. I am a part of many scientific organizations. I am running 3 conferences in India. I am a chairperson of Hair Society of India, and I have trained over 300 to 400 doctors in the procedure of hair transplant. Now I am going to tell you exactly what you expect month-wise. So in the first month, immediately after the transplant, for the first 5 to 7 days, you will be taking a lot of care by spraying your grafts, regularly washing them, washing the donor area, washing the recipient area gently from the 3rd day onwards, spraying your grafts in the first 48 to 72 hours frequently, that is every half an hour to every hourly, to keep them moist and clean. You'll be on anti-swelling and painkiller medicines if required. So this is what you do typically in the first month. In the first week. After the first week, you will typically start to go out more often. You can do more activities, take walks, brisk walks, continue washing till the scabs completely fall off. Make sure by the 2nd week end they fall off completely, and by the end of the 2nd week, that is around by the 14-15 day, you can resume all your activities like gymming, playing sports and whatever else that you want to do. Next, then you start your medication and post-care treatments if suggested by our doctors, like mesotherapy, like cyclical medicines, topical applications, oral medications, and if you're suggested, if any PRP, GFC or exosomes or any other procedures which you must undergo, that you will start typically after 15 days to 1 month. Now typically 1 month is over, then what can you expect? Between 3 weeks and 6 weeks, your grafts will start falling. How many will fall? Nobody knows. It could be 10%, it could be 90%. But some grafts will fall. When whatever you see looks fuller will now start looking a little more empty, and you'll be alarmed or you will start panicking. But don't worry. Here, this is the shedding phase. Only the top hair which you're seeing, which is outside, will fall. The bulb or the root or the stem cells are still there, and they will grow the new healthy hair over time. So typically between 1 and 2 months, you'll see this shedding happening. By the 3rd month, the shedding will stop. But meanwhile, you will continue doing your mesotherapy or your growth factors or GFC, PRP or exosome session monthly or 15 daily as suggested by your doctor. So do not forget these sessions, and do not forget your topical and oral medications as prescribed. Then by the 3rd and 4th month, you may find some amount of growth happening. This may be as less as 10-20% or maybe as high as 60-70%, depending on how much hair you shed in the first place. Now 4th month is gone. You start the 5th or 6th months. By this time, you will see approximately more growth coming up. This could be at a rate of 10-20% or even 30-40% every month. So by 6 months, you may start seeing a lot more new hair which have started appearing. This continues till the 7th month, 8th month, 9th month and 10th month. Typically, most of the hair follicles will spring out, and you'll be able to see hair by the 9th and 10th month. Then they will achieve length gradually. So by 12 months, you'll actually see a much fuller head of hair. So when patients ask me, doctor, when will I get my hair back? I said it takes 9 months for a baby to be born, and that's roughly the amount of time it will take for your hair to come. So do not panic if you don't see any hair growth for up to 5 to 6 months, because beyond that there will be a spurt of hair growth if the hair transplant is performed properly and you're taking the proper post-op care and medications. So you're going to see hair growth typically after the 5th or 6th months, which will continue increasing in volume and density up to the 10 to 12 month. Some patients are late bloomers or late springers. I've had one patient who showed no growth till 8 months, and then he suddenly grew hair between the 8th and the 15th month. So we ask the patient typically to wait for around 15 to 18 months for maximum amount of hair growth that he can expect or he should expect. Beyond that, if you do not get any hair growth, then yes, probably the procedure hasn't gone as well as we wanted it to go. To know more and to understand and to fulfill other queries or questions that may run through your mind or that you may be thinking about, do call us, do consult us, go through our website or call on the numbers below, or do follow on this channel or follow us on Instagram. Thank you so much.